The hospital provides us with masks, and there's that home visit. So, but it could have made their work much more easier if I was somewhere near within the hospital that they can assess me so quickly.
What makes for conversation between a patient and myself the state of healthcare in Kenya as regards the diagnosis and treatment of tuberculosis as is. She is being treated for a strain of TB that is resistant to the first line and second line of treatment known as extreme multi-drug resistant TB or XDR.
My life changed overnight. I am in a room. I'm not supposed to move so much. As per last week, I was buying the medication. That there is medicines for 3 weeks. So that one has eased a big burden from my family. Yeah, we used to spend about 16,000 a week.
The civil society having since called on the government to urgently address what they regard as, quote, the lack of investment in the treatment and care of XDR TB patients through an advisory note.
Up until last week, the patient's family had to buy some medicine, but the government has now begun providing some of the medicine that the patients are buying. One of the medicines, which is viomycin, is not registered locally by the Pharmacy and Poisons Board, and for that particular reason, it becomes difficult to import it into the country. It is a key medicine that this patient would need to help boost her chances of recovery from her condition as an XDR patient.
The patient was diagnosed in October last year, the third such case in Kenya of XDR TB, 2 of the patients having since succumbed to the illness.
This patient is being managed from the home, and that this is not outside our guidelines. I would like to assure Kenyans that there is no cause of alarm for patients who have drug-resistant tuberculosis to be managed from home. Isolation does not necessarily mean to be confined in a particular building.
That said, the government needs 15 million shillings for the completion of an isolation ward at the Kenyatta National Hospital, even as pressure mounts from the civil society to fast-track the process amid concerns that the lack of the facility could result in the spread of the infectious disease.
For us to be able to treat the patients, especially those who are in an infectious stage, in a manner that respects their dignity.
This work began about 5-6 years ago, and in the final stages, there was an escalation in cost when it came to the ventilating system that is going to extract the organisms away. And therefore, the cost went high. The Ministry of Public Health has been in touch with the Ministry of Finance, and I'm happy to say that we've presented these as part of our revised estimates.
Kenya has a TB disease burden as it ranks 10th on the list of the highest tuberculosis population in the world, and while considerable gains are being made in the fight against TB, hurdles like that of managing TB may hinder the fight against the disease. Mbilu, Citizen Live at 9.